Former President Biden has announced he's been diagnosed with an aggressive form of prostate cancer. His doctors say it has already spread.
KTVU's Tori, she is here live now with details about what this treatment options could be for the president. Tori?
Yeah, good morning, guys. This news came out over the weekend, first with the announcement that a doctor of the former president had found a nodule on his prostate gland. The prostate cancer diagnosis was shared just yesterday, and I spoke with a doctor from Johns Hopkins University about what this means for the former president now. The 82-year-old former president sharing on Sunday that he has been diagnosed with cancer, Biden's team sharing a Gleason Score of 9, indicating this is a very aggressive form of cancer. A doctor gave us more insight into the treatment of this disease.
The treatments are fairly straightforward when one has metastatic prostate cancer in that we know hormonal therapy is going to play a role, essentially suppressing the testosterone, the male hormone testosterone, because prostate cancer is feeding and fueling off of testosterone. So there are many treatments that have been developed, for decades and even in the past decade, increasing treatments that come in the form of a pill or an injection.
Now, the president's team has announced that his cancer appears to be hormone sensitive, which Dr. DeVille says is a good sign.
The main challenge, and I think why we're hearing this term hormone sensitive, is that eventually the cancer becomes hormone insensitive, or what we call castrate resistant. And that is where you tend to see the progression and the spread.
Now, the standard test to determine if cancer is present is a blood test called a PSA test. This is recommended by doctors in most patients over the age of 50 or younger for those considered high risk. One question some have is how this cancer wasn't caught sooner, especially if it can be caught by a simple blood test. But Dr. DeVille says some older patients may stop getting this screening as they age. But we do not yet have details on whether President Biden was regularly screened with the PSA test, particularly during his time in office. Now, the president's diagnosis is coming almost 10 years to the day after his beloved son, Beau, died from brain cancer. Beau's death spurred the president and Dr. Jill Biden to advocate for cancer breakthroughs here in the U.S. Coming up at 9, we'll hear from another medical expert about this diagnosis. Andre?
Tori, thank you.